So again, we got, oh Lord, don't tell me you're gonna glitch. Don't tell me. Don't tell me you're gonna glitch. Okay, so we got keratinocytes. They produce glycolipids and they prevent water loss. And that's our epidermis. So the dermis is the thin papillary layer, or the thin papillary layer, and that starts from here. And then it contains a lot of fibroblasts. They produce collagen, and that's what keeps two tissues connected in between with the collagen. So blood vessels and nerve endings are present here for pain and fine touch. So that's when, if this layer is damaged completely, there would be no pain, no fine touch feeling, and if there's just some level layer remains, some nerve, not the full layer is damaged, then the pain, excruciating pain, and sensation to touch will still be there. So, the deeper layer of the dermis, the deep reticular layer. So this one is thin papillary layer. Yeah, it's a papillary layer. Okay, hold on. I'm just gonna make sure it's understandable. Okay, this is the thin papillary layer. This is thin papillary layer. And this one, right here, is the deep reticular. One is reticular, one is papillary. So the papillary layer is thicker than papillary because of the increased collagen. It's excellent tissue support. Fibroblasts produce that provide elasticity. Nerve endings in this layer determine a vibration and deep pressure. So if this level is still intact, then the patient will sense the deep pressure. Good sign. Good sign. Hypodermis, well, that's this layer. Contains fat and connective tissue and anchors skin to the muscle. Regulates body temperature. I guess the blood vessels should be there that dilate to increase the blood flow in this layer. One note of importance about the electric burns. So fat and bone offer more resistance, while muscle and nerves and blood vessels have less resistance. So current that passes through the brain, heart and kidneys is more dangerous and leads to life-threatening sequelae. Current can cause muscle to contract, to harden. That muscle can fracture long bones and cervical spine. So for example, paramedics come to the scene, they see a person and he was and there's what is it, like some kind of cable is nearby that has sparks on it, so we know he was hit electrically. And there's a small little injury right here, and you think they can think, oh, it's a small burn, there's nothing serious, but actually it traveled all the way through and came out of the leg. So they should take a look at his feet if there's an exit wound. Not only that, if it traveled all this way, it could have affected the heart. So within 24 hours, he can start to have arrhythmias and have the cardiac arrest. Also, if it went through the cervical spine, that current that hits the muscle, it causes it to contract. It causes the muscle to contract so bad that it can fracture the long bones, the femorotibial, whatever it is, humerus, or, for example, the spine. Where is it? Cervical spine. So when the paramedics come to the scene, they should treat the person as if he had a spinal injury too. They should put the cervical cast on him and do the whole thing about log rolling and everything. So let's say this is a cast going to be. Cast. Not a cast, but you know, the some kind of support. Port and secure. Brace. Oh, there we go. Better word. Brace. Brace. So they should put a brace and treat it as if it was spinal cord injury as well. Kidneys, well, it's just self-explanatory. Brain, well, unconscious, and yeah. So treat the patient as if they have a cervical spine injury until rolled out with with X-ray. Dysrhythmias, cardiac arrest, myoglobinuria. Oh yeah, if the electrical impulse also damaged the muscles, they can release the myoglobin, and this will damage the kidneys, cause acute kidney injury or tubular necrosis, whatever we will be faced with. Can occur during the first 24 hours. And all this thing can occur 24 hours, even though